Hello, everyone. Come on in. It's time. Join us. Welcome, everyone, to this year's SPR Presidential Plenary entitled New Horizons in Prevention Science, a dialogue with past, current, and future SPR presidents. My name is Brittany Cooper. I'm the current SPR president with just a few more days on my term before I hand off the baton to Dr. Phillip Graham. I'm thrilled to be bringing together and moderating discussion with this group of prevention science legends on the stage. But before I introduce them, I want to do some stage setting for the conversation. So if I can have my slides, that'd be great. Wonderful, thank you. About a month ago, the National Academies published a consensus study report outlining a blueprint for national prevention infrastructure for mental, emotional, and behavioral disorders. Given the timing of our conference and the role SPR plays in bringing together diverse prevention science researchers, practitioners, and policymakers, I thought it provided an ideal platform for highlighting and discussing the implications of this study. As you can see from the quote on the screen, the focus of the committee's recommendations is how to strengthen, coordinate, and fund existing structures to close gaps, prepare workers, and maximize available data to deliver needed preventive interventions. And what I'm hoping we can do over the next hour or so is reflect on ways that our prevention community, and SPR specifically, can play a role in bringing these recommendations to fruition. I'd like to begin by handing it over to one of the study's committee members, Dr. Margaret Kuklinski. Thanks so much for being here today to share more about the process and results of this important report. And we'll do that before we engage in dialogue with the rest of our panelists. So, Margaret, take it away.
Thank you, Brittany, and hello, everybody. I am, as Brittany said, Margaret Kuklinski. I'm the director of the Social Development Research Group at the University of Washington and also a professor there in the School of Social Work. I had the pleasure of being on the committee that produced the report we're going to spend the next 20 minutes or so talking about. That report was a consensus study. It is called Blueprint for a National Prevention Infrastructure for Mental, Emotional, and Behavioral Disorders. So National Academies consensus committees represent many voices and perspectives. Our committee members are listed on the screen. They come from a variety of institutions across the country. I want to acknowledge our chairs, Marcella Alsan and Martha Gold, who are critical to the leadership and production of this final report every step of the way. You'll also see a few familiar names on that list of committee members. I believe that Lisa Saldana is here. I know that Velma Murray is here, and all of us would be happy to talk with you about the report after this presentation or whenever you run into us at the conference. These reports also aren't produced without a lot of dedication from National Academies staff and also the funding of the sponsors. But I do want to say that the recommendations that I'll tell you about in just a few minutes are those of the committee members and not the staff or the funders. So each consensus committee is organized to respond to a specific statement of task. That becomes the committee's North Star and also the North Star for the report. The consensus study, the statement of task for this committee, for our committee, was to develop a blueprint, including specific actionable steps for building and sustaining an infrastructure for delivering preventive interventions targeting risk and protective factors for behavioral health disorders. There were 4 aspects to our charge. They were to identify best practices for creating and sustaining that infrastructure, to identify funding needs and strategies, to identify research gaps, and also to make actionable recommendations to develop and support infrastructure components. So why was it so important for us to take up this charge now? Well, as this group knows, behavioral health concerns across the lifespan take a tremendous and also a mounting toll. They include pain, suffering, and economic impact from things like suicide, deaths from alcohol use, adolescents feeling sad and hopeless. These things have economic cost and also are associated with a decline in the well-being of Americans in relation to other countries that has occurred over recent decades. We also know that we can use effective prevention strategies to improve these things, to reduce pain, suffering, and even disorder, and those prevention strategies can yield a long-term favorable return on investment. So with that backdrop, our report is premised on the idea that supporting prevention with resources and a stronger infrastructure can yield multiple benefits. So the committee concluded that an effective prevention infrastructure would look like the figure you see on the right-hand side of your screen. That's what it would take to get to improvements in mental, emotional, and behavioral health outcomes and also well-being. So preventive interventions, programs, policies, and practices in this infrastructure are to be delivered through a variety of systems, including community-based organizations. And you can see those systems at the top of the slide. The major components of the infrastructure are interconnected gears that, when functioning smoothly, together lead to stronger protective factors and to reductions in risk. And it's through those pathways that those improvements in mental, emotional, and behavioral health and well-being are found. The committee also had two principles guiding its work and also the writing of its report. The first was that infrastructure needed to be organized in a way that contributed to greater health equity. The second is that the learnings, tools, and strategies from implementation science would also be critical in getting to the goals and outcomes that infrastructure would support. So what I want to do is transition to recommendations related to each of those components. They're the topics of chapters 2 through 7 in the report. I'm only going to touch on them briefly, but there's a lot more information that you'll find in the report, and I'll share a QR code at the end of this presentation because the report and supporting materials are available digitally for free. So to start with chapter 2, I'm going to highlight the major findings related to chapter 2, which is all about evidence and also recommendations. So the first finding is that a major success in the field has been that we now have an array of effective preventive interventions. They primarily are for children, youth, families, and young adults. And so what this means is that there is a gap to fill in research and understanding of effective prevention interventions across the lifespan, interventions that could support midlife adults, established adults, and older adults. It's also critical that community-based organizations and others implementing those interventions know that they exist. They need to know where to turn when they have a particular prevention goal if they want to use an evidence-based strategy. So the committee's recommendations addressed both the gaps and also the need for a clearinghouse to be overseen by SAMHSA. Gaps would be strengthened through support for research, and a dynamic evidence-based clearinghouse would be managed by SAMHSA, or if HHS is organized, whatever group carries out SAMHSA's functions to keep that evidence-based clearinghouse up to date. The committee also recognized how important it was to support the prevention workforce in a number of different ways. There were two key findings. The first was that the prevention workforce is not well defined. And an example of that is many different folks in many different roles actually carry out prevention tasks in a variety of settings. The second finding is that an effective workforce would be characterized in a number of different ways, including detailed competencies, training and certification, a robust pipeline, and other qualities that you see on the screen. So the committee came up with 4 recommendations to support an effective workforce. The first is that the workforce be described and enumerated, by that referring to how many people and in what roles. The second is that the standard occupation classification system, which classifies workers into occupational categories for data and analysis purposes, be updated to include prevention roles and up-to-date workforce descriptions. The third is that the prevention workforce would benefit from a high-level coordinating office, and that office could take as one of its areas of focus the idea of providing training and support to prevention workers in a variety of settings. I'm going to jump to Chapter 6. I'll come back to Chapters 4 and 5 in a moment. But Chapter 6 is about a topic that is very important to the prevention field. It's foundational, and that is the idea of funding. There were three themes to the committee's findings. They were that funding needs to be robust, sufficient, and sustainable. And right now, as I think this group knows, there is not adequate funding for prevention, and that's a major impediment to an effective prevention infrastructure. The second finding was that there are some things that can help increase prevention funding. They include support from Medicaid, but there are barriers to actually using Medicaid dollars that could go towards prevention. And those barriers have to do with the kind of roles that are covered, the settings in which services can be covered, and the types of interventions that are coverable. The committee also found that beyond the federal government, there are other opportunities for innovative sources of funding, both in the public sector and through public and private partnerships. Those things include, for example, tax strategies that in some states are used to support prevention. And the last thing that the committee found related to funding was that savings from the implementation of mental and emotional and behavioral health interventions often are not well understood in economic terms. Part of that is because of the wrong pocket problem, which means that benefits from prevention don't necessarily accrue to those who are making the investments in prevention. And as a result, the favorable return on investment from many prevention activities is not well understood and can lead to underfunding. So the committee had 4 recommendations on the topic of funding. The first is that prevention funding be significantly increased, and you can read in detail about that recommendation in the report and a companion study by Tammy Mark, who is an expert brought in by the committee. The second is that Medicaid waivers be used a lot more to overcome those barriers to using Medicaid to cover services in future prevention activities. The third is that Congress support those innovative funding strategies. And the fourth recommendation is that we find support for better articulating the downstream economic benefits of prevention, again, as a foundation for motivating greater support because we see the return on investment that prevention has. I'm going to just briefly focus on the recommendations from chapters 4, 5, and 7, not because they're less important, but just in the interest of time and the other goals that we have for this panel. So chapter 4 is all about data, and the important sort of reason that the committee thought about data as a key element of this infrastructure is that data provides, it helps us identify both strengths and needs. It helps us monitor trends and the results of our preventive interventions, course correct as needed, and celebrate success. So the committee recommended support for the CDC's Places data set as a rich source of local data that could meet prevention needs. It also recommended that support for data infrastructure be included in grant funding mechanisms, and that a measure of population well-being that's reliable, valid, and widely used be developed, because we don't have that. Chapter 5 is all about governance, and by governance, I'm referring to systems and practices that ensure accountability, transparency, responsibility, and fairness. And the overall recommendation here is that we really need in the field of prevention for governance to be assumed at the highest level in the executive branch for that visibility and high-level support that prevention needs. Chapter 7 is about policies and recognizes the critical role that policies can play in mental, emotional, and behavioral health and well-being. The committee's first recommendation is that support for policies that improve mental, emotional, and behavioral health be maintained. Those are things like the Earned Income Tax Credit and poverty supports, and that policies that don't or are counter to these outcomes are de-implemented. The committee also wanted to lend its support through recommendations to the importance of incarceration and firearm violence to mental, emotional, and behavioral well-being. The second and third recommendations get at those areas, encouraging decarceration where possible and support for mitigating firearm violence. And then finally, we know that in concept, a lot of social policies could affect mental, emotional, and behavioral health outcomes for the better, but we don't necessarily have the empirical or research support to show that they do. So that last recommendation suggests that we need more research to truly understand the effect of social policies on mental, emotional, and behavioral health. So these are the report's recommendations for what the committee really thought is needed to provide that supportive infrastructure that can make everything in the field of prevention and health promotion work more effectively and get to the outcomes that we all want. We are now disseminating the report and its findings in other places like this one, but we also have a call to the SPR board and to its membership. There are things that you can do to help disseminate and implement the committee's recommendations, So we know that SPR members live in all states across the country. We need for you, in whatever ways you can and are motivated to do so, encourage through your work the uptake of these recommendations. You don't need to take on the entire report, but there may be pieces that you are particularly equipped or motivated to contribute to, whether that's developing interventions for other age ranges where we need to close those research gaps, lending your voice to the need for data infrastructure. Whatever it is that motivates you, we can use your help disseminating these recommendations. This group also has a long history of writing really effective proposals grounded in rigorous science. We need members to keep doing that to close those research gaps, both in the area of intervention development and implementation. As a society, and also in partnership with the National Prevention Science Coalition, we also need this group to advocate for support for prevention infrastructure. I know that there's an advocacy tab on the Prevention Science website, or Society for Prevention Research website. Pam Buckley is also a voice for those advocacy efforts. And so if that is the way that you want to contribute, I encourage you to seek out those opportunities. And then the fourth thing that we all can do is engage in collective action to ensure that prevention science and implementation, which this community has been working on for nearly 50 years, that support for strong, scientifically grounded efforts continues. I want to just close with a couple of quotes from our chairs, which get at the main messages of this report. The first is from Marcella Alsan, and it says, she says, the costs associated with our nation's mental health and substance use crises are unbearably high and often preventable. Effective prevention programs are available at every level. We need to build systems and supports to make evidence-based interventions available to all. And then Martha Gold says, with resources and data, leadership and partnerships, and a number of evidence-based approaches to draw on, our nation can do better in intervening across different settings and along the life course to promote well-being and prevent mental, emotional, and behavioral disorders. So I want to close here. Our report and brief supporting materials are available by Googling Blueprint for Prevention Infrastructure. By taking a picture of that QR code, you'll find a link. And if you have questions, you can reach out at the email on this screen. Speak with Velma, speak with me, speak with Lisa, any committee members you know. We'd be happy to talk with you more about the report and how to help those recommendations be taken up. So thank you very much for your time today.
All right. Thank you so much, Margaret, for setting the stage for our conversation. And we truly want this to be a dialogue, and so I'm excited to engage our panelists in some further discussion. You've already met myself and Margaret, and I want to give the rest of the panelists a chance to introduce themselves and share a little bit about the unique perspective they bring to this conversation. So, Rico, take it away. Just an introduction. There's a mic right there if you want to sit down. Yeah, you're welcome to stay there.
Up or down? Is this good?
Yeah.
Okay. Well, I've been dragged out of retirement for one day at least, for my first time at SPR in 5 years, and it's great to see so many old friends and to meet new ones. We had a rousing discussion about how to meet how the Society for Prevention Research can meet the challenges of the current administration, and I think we came out with lots of good ideas. Let me now focus on this panel. I just want to say, give you some condolences to the report's authors. I just want to recall an experience that my colleagues, and many of you will know these names, Abby Fagan, Felipe Castro, Mark Greenberg, Ralph Hinkson, and Kevin Haggerty. And I completed a comprehensive chapter on prevention of substance use for the Surgeon General Vivek Murphy's report on facing addiction in America. We finished this report in September, and it was launched in November 2016. Trump didn't have any idea of what he was doing, so in the first administration, so we got actually several months of good play out of that report. Unfortunately, we're not in the same situation in Trump 2. So I feel sad for the authors of this NASM report, as Trump is on a fast track against science and appointing people unqualified to understand, let alone be guided by this fine report. As Margaret summarized, it's a great report. I just fear that it might be ignored by the current regime. So, what should prevention scientists do now? And
Actually, 1 second, sorry to interrupt you, Rico. I just want to make sure everyone gets a chance to introduce themselves, and then I'll introduce the discussion.
Introduce themselves.
Yeah, just introduce yourself. That was a great introduction. Thank you.
I'm sorry, I can't hear you.
Oh, I'm sorry. I'll speak louder. Yeah,
I will just have a very brief introduction. And then we'll come back to Rico.
They're waiting with bated breath,
Phillip
though,
and then Rico. I'm Leslie Lev. I'm at University of Oregon and one of the past presidents of SPR. And I was asked on this panel, I think in part because of my experience in workforce development around starting prevention science graduate programs, being on the SPR training committee. And so that is one of the points that I'll be speaking to today.
Thanks, Leslie.
Good afternoon. I guess the first thing, I wish I was a past president.
Nah.
So good afternoon, Phillip Graham, RTI International. I'm excited to be here to have this conversation. I think I was asked, but in addition to being the future SPR president in about a day and a half, is that my work has always started in community and from an applied cultural lens. And so helping us understand how we engage systems at local levels to really move forward the research and evaluation we do and bringing that perspective to the conversation. So happy to be here and happy to turn it back over to Rico, who has the discretion to say whatever he wants, whenever he wants.
Well, actually, yeah, so again, I'm going to interrupt. Sorry, Rico. We didn't want to start this conversation without acknowledging that when it started, it was at a very different place and context. So I asked Margaret, I prepared a question for each of the panelists to respond to, and then there'll also be an opportunity for the other panelists to react. So we wanted to start out with Margaret, since you've been a part of this process from the beginning of writing this report. Obviously, the report was originally launched in December 2023 under the Biden administration in a very different place and time, and released in April of 2025 under the current administration. So to what extent do you feel like the recommendations from the study still hold, given the changes in the national behavioral health research and service landscape that Rico alluded to? What do you see as the greatest opportunity and greatest challenge to their implementation?
All right, and this is on, I think. Right, okay. So thank you, Brittany, for that question, and thank you, Rico, for conveying the challenges with the report. And I just want to say, we did write this report. It was really being finished in the fall of 2024, and you can imagine what a different emotional tone there would be to this conversation were we in the place that we had been in prior to January of 2025. So I want to acknowledge that. But Brittany, you asked me about the recommendations and also their implementation, and I'm really glad there are two parts of the question, because the recommendations are grounded in science, and that science has not changed in the space of 2, 3, 4 months. So I think as probably many of you in the audience know, National Academies was actually founded during Abraham Lincoln's time, and it's built the reputation and influence that it has, in large part because of consensus studies like these that bring together diverse perspectives to use the latest science to report on questions of interest or statements of task. And that's what our committee did. We turned to the science, made recommendations based on the science. People brought various experience and histories to the work in a number of different ways, and those things still stand. The time is not ideal for taking up the recommendations of the report, obviously. So it's the implementation piece of the work that is so challenging. And I think, I would say the challenges, they're ones Rico got at. You know, cuts proposed and threatened to NIH and SAMHSA. Those are really difficult for implementing the report, for generating new knowledge, for translating that knowledge to states, to communities. You know, also I think the proposed policies that are likely to make vulnerable populations face even greater challenges, those I think are going to make it harder to do this work, because the attention may be drawn to just trying to support people rather than going upstream. And then the anti-science movement, all of those things really are the climate in which we're releasing this report. It's not easy. But I refuse to end on a totally dour note. You know, I think that there are reasons to be optimistic, as you ask in your question. You know, the first is, I can say in concrete terms, prevention science has never been an easy field to do work in, right? We're in this field because of our commitment, because of our effort, because of our beliefs in what we're doing. I think it's more important than ever that we maintain all of that. As came out in our discussion this morning, prevention science has been through challenges to funding before. During the Reagan administration, I forget what the other one was, I can't think of it at this moment. But people, that sort of challenge has led to creativity. We heard about people seeking funding from places that you might not otherwise be motivated to seek it from because you didn't need to. I think we will do that. Local communities are continuing to find funding to work with us. I hope that many of you have that same story, that people are trying to make it work because they believe in the work that we do and the support we provide. So that will go on. We will maintain our commitment. I think the other thing that gives me some hope, or where I think there's opportunity, is that this is an incredibly strong society. I think that many of you out in the audience probably feel as I do, that this place is my professional home. I look forward every year to seeing so many people here, people I don't get to see otherwise, and talking about projects and things we can do together and learning from all of you. We're going to need that collective spirit to continue over the next several years. We will also need the advocacy committee. There may be room for a task force to think about how to implement the recommendations of this report. And I think we also can work at the local level, at the state level, at places wherever we can find that are not so tied to the federal level to keep doing this work. So I'll finish there.
Thanks, Margaret. So we have time for other panelists to react to this question or just share your own perspective. So happy for you to do that for a couple minutes before we move on to the next question. Any other thoughts that you'd like to share?
Rico, you want to continue?
There we go. You have given hope to something that's very difficult to achieve. As you said, this would have coming out in May of 2024, you know, just before SPR last year, would have been a different situation, and many things could have gotten in the pipeline. And now, I think you have the best strategy for, you know, how to move forward. We're an organization that will, SPR is an organization that will last beyond the current administration, and creating a task force on how to implement some of these ideas is a great idea. I think this gives to local community efforts that are already doing prevention of structure. And I think that we will be finding, as many of us talked this whatever it was, at lunch today, about, you know, how to find the local supporters, both state and local or regional supporters that could fund this, foundations, et cetera, that could fund not just implementation of the report, but getting the knowledge out and getting, hopefully, in the long run, we want to see tests of some of these recommendations as well. So I think...
So you have some optimism still?
What?
So you still have some optimism?
I always have optimism. You know, I had so much optimism that when Vivek Murthy was in the second, was in his second administration with Joe Biden, I wrote him a little note and then said, hey, we can get that, dust that report off now that everyone's ignored for 4 years and move it ahead. So I always have optimism.
Thanks, Rico.
Do we have time for?
Oh, we
another
do.
comment?
Yes,
Okay.
please.
I just want to, a point I guess I want to make is I think also we can build on our strength of being nimble and flexible and pivoting, because it does, I think, as we're all feeling, the priorities and policies that come out are changing on a weekly basis, if not faster. But this group and others in the behavioral health prevention field are good at pivoting to those contexts. And so to put one example to that, I think I don't remember, Thursday or Friday, the MAHA report, Make America Healthy, or America's Children Healthy Again, came out. And you can read that with the eye that it really is focusing on prevention as a priority, kind of the upstream effect. So I know, despite some of the other context around it, just looking for those opportunities where we see prevention being highlighted, which I think might be in that report, and thinking about how to use that as an avenue to support the objectives of the nascent report.
Thanks, Leslie.
And I wondered, Leslie, since you have a prevention department, if there's any interest in incorporating this type of report into curriculum.
It wouldn't be in the intro to prevention science.
Right. Well, I'll just speak that to make sure we get that on the webinar. Dr. Jen Doty just spoke out in the audience, who teaches Intro to Prevention Science at University of Oregon, and just told us it's going to be in the curriculum for that class.
Yeah,
so
there you go.
I'm sure there are probably other examples out there.
And that will keep it alive, you know, by the time those students get out into practice. It might be a different administration.
Great, thank you. Well, thanks for getting us started with that. We do have, Rico, your official question now. If you're so the question I wanted to ask Rico specifically is, the report highlights the importance of enacting policies that support prevention to create environments where prevention is made easier. What role should or could prevention scientists play in policy? And what can we learn from the challenges encountered during the founding of prevention science as a field in terms of education and advocacy with key decision makers?
I will provide a comprehensive answer to that, and it'll only take me 3. No. So let's just remind all of us that prevention, this society, was started in 1991 by a group of, people, like-minded people across several disciplines, and they decided that it would be a multidisciplinary society. Now, that sounds really cool because they wanted, people from all different disciplines to get the smartest people together so they could solve wicked problems like how to prevent something before it occurs, which I have to tell you, at the beginning, people were saying, how do you show that? How do you show prevention works when you're preventing something that didn't happen? That's how people thought about it in those days. So they really had to recruit multiple funding agencies, NIDA, NIAAA, NIMH, and have added multiple agencies over time. If this isn't advocacy and policy, I don't know what is. So, they brought CDC, NCI, OB, SSR. I'm reading initials that Jennifer wrote. You guys hopefully know what they all mean. ACF, nursing research, complementary and integrative health, NICHD, and ODP. These are all agencies that fund the society now. And we have multiple disciplines, and we had to recruit those people because departmental-based or single disciplinary-based organizations like psychology, sociology, whatever, they have home departments in every university, and so they're always big organizations. A multidisciplinary really tries to say, here's our goal, here's our ideas, and tries to attract people to it. So it's really an attraction model, and we have public health, psychology, sociology, education, medicine, social work, criminology, many other disciplines come together at SPR to do the very best thinking and best work that they can do. So our remit, whether or not we knew it, was always policy and advocacy right from its beginnings and institutionalization. In my experience from the early days of prevention research, 2 things were necessary for prevention science to have reasons to affect policy and to have some basis for affecting policy. First was science. We needed, and I'll talk a little bit about that. And second was community prevention practice. And I think these were like co-equal things that were necessary. There had to be somewhere that science would be applied in community practice, and it would be useful and help save lives or save children from negative experiences or throughout the life course. So at the time that we were incorporated, we had the science of epidemiology, risk and protection, and their distribution in in different geographical populations as well as across development. We had articles published early on, like here's one self-promotion issue, like risk and protective factors for alcohol and other drug use problems in adolescence and early adulthood, implications for substance abuse prevention in the Psych Bulletin. Probably all of you have cited that article at one time or another. But that was in 1992, so we had that science that could help inform communities about what the things were that should be targets of preventive intervention research. In addition, to these potential causes identified, in my day, the science tilted towards trying to understand how to address those risk and protective factors in ways that actually might work to prevent problems. And we found many things that did work. Not everything that all of us tried worked, but we found many things that did work, and that also gave us a stronger sense that the underlying potential causes were actual, really true causes, because if we changed them, things got better. So I think we had the basis for policy and advocacy at the community level. And I have to say myself that my passion and driving interest for all my work, research, advocacy, policy, influence, and prevention is making a difference in communities. And when you get old, you lose words sometimes. I activated that interest. That's not what I want to say, but I acted on that interest by attending practice conferences, not just these kinds of science conferences or public health or whatever, psychology conferences, but attending practice conferences in states and communities, getting together with a national prevention network of single state prevention coordinators, and getting NPN members to come to SPR and even getting them on our board, and getting SPR members to the National Prevention Network meetings as well. So the importance of community and community partnerships to support efficacy and effectiveness of preventive intervention and advance the science was really critical to me personally. And as it turns out, getting involved in these states and communities, I didn't have necessarily ulterior motives, but getting involved with these states and communities, attending these state conferences. I can't tell you how many state and local conferences David Hawkins and I have attended over our career, but my wife will probably can tell you how many times I was out of state going somewhere else. But when we did that, these state and local people become champions for prevention. And in fact, I recall this incident that happened, if you recall, Alan Leshner, when he first stepped into the shoes as director of NIDA at that time. He says, Catalano, I know you. Everyone's talking to me about you. Oh, but it's really not just you. It's one word. It's Hawkins Catalano Prevention. It's all the three of them. I know. Okay. So by doing the work at the ground level with community practitioners, helping them understand the science of prevention, it moves upstream to those who are in policy positions to make them take notice. Oh, if I got involved if we spent more of our money in prevention research, this might be popular in the country. So that turns out to be the policy. And I'm just wondering how many of you are going to these state conferences these days. And I think what we talked about at the 12 lunchtime is we need to get more involved in our prevention practice communities. I know Phil this is your area, so I'm not going to go all the way over to, talk. I'll let you talk about that. But I think it's really important that we continue to do that, because you get then not just the attention of federal agencies, but also politicians. And we found on both sides of the aisle, in Pennsylvania, Tom Ridge, who was the first director of Homeland Security, but was the governor of the state of Pennsylvania, became very interested in prevention and really funded a lot of preventive work in the state of Pennsylvania. Do I have anything else that, just one, I might save this for the discussion time later, but I do want, I'm probably out of time, right? The
Oh, you're
usual.
fine.
What?
You go ahead. You're fine. We're
Okay,
good.
you go ahead. You won't see me again. The values of democracy, local decision-making, choice and buy-in, and prevention, and democracy go together, okay? It's just something that we see 50501 getting local demonstrations out all over the country. You know, in my day, we did big demonstrations in a single place like Washington, D.C., but today, they're doing them these distributed things, and I think of it like community prevention. These are what we need to be doing more of. This is what we need to be doing more of to get to our prevention practitioners to sustain us during this time. Democracy doesn't defend itself, and we can't expect politicians to save us. So I think we need to not capitulate, but organize and find new funding sources, find new ways to instill our students with the values of prevention and the science of prevention so that we're not disbanded, but ready to move ahead when hopefully when, I'm hoping the midterms to make a big difference. Thank you.
Thanks, Rico. We're going to move on to our next question, which is for Leslie. A little bit of a change, but taking up the workforce topic again, bringing that back up to the forefront, since, of course, working with on-the-ground prevention providers and collaborations with communities requires a focus on not just the prevention science research workforce, but also the boots on the ground. So the report acknowledges that the mental, emotional, and behavioral disorder prevention workforce is not well defined, but that it is a critical element of the infrastructure needed. In your various educational and leadership roles, research leadership roles, Leslie, what do you see as the most efficient path forward to assuring prevention science is integrated into the training and support of this workforce, given its somewhat undefined and diffuse nature? Thanks.
Thank you. There we go. Yeah. Thanks for that question, Brittany. And it was just pretty exciting to see that there was a focus on workforce development in the whole NASM report. That was, it was unexpected and a pleasant surprise. So it's great to see that. I'm going to comment on, I'm going to make 4 points here, and the first 2 are pretty aligned and kind of amplify some of the recommendations from the report, and the other 2 maybe are going in a slightly different direction given the context that Rico and Margaret just put forward, and all of us are aware of course. The first point I would say, and this is to amplify that point of the prevention workforce not being well defined. So the report talks about how we really need to get better data and classify and count and categorize and have a system for knowing who our prevention workforce is, where they're located, exactly because of the multidisciplinary nature of our field, as Rico just described, which I absolutely agree with. And I would extend that to say that we need to do that at the educational level too. So now we have dozens of prevention science master's programs, doctoral programs, even undergraduate minors and foci, and we have the same challenge there. We are required to enter a SIP code, which is I had to write that down, classification of instructional practice. You have to identify your degree with a discipline. So for things like biology or clinical psychology, it's pretty straightforward. For prevention science, because we're in different, mine is in a college of education, Brittany's, yours is in
Human Development,
HDFS. We have some in public health, some in psychology, so they're very multidisciplinary, and so all of us are identifying different SIP codes or identifiers for our degree programs that are not in alignment. So if anyone were to try to look at a national level, where are our prevention trainees coming from in our university settings, there is no code. We're spread out across the map. So that's, I think, really amplifying point 1 in the report. The other thing that I want to amplify, and the report talks a lot about building on the strengths that we already have and not necessarily creating new systems or structures, which I do really resonate with, and I think that's even more important now given the context we're in. And at the same time, I would say we're just so fortunate to have a lot of amazing structures and supports in place in the workforce development. So ECPN is one that I think SPR is very proud of and is a model for other societies in terms of our support for early career trainees. And so I would suggest ongoing support for that, not only within our society, but certainly across other societies that serve behavioral health prevention structures. But also the PTTCs, Prevention Technology Training Centers, they're in each of the 10 regions. They are just phenomenal in putting out literally dozens of free webinars every single month that detail specific aspects of prevention science to the workforce. They're free. You can listen to the ones in your region, or you can listen to the ones in any other region. So those are just a remarkable infrastructure that I think we already have and we could continue to expand on. Rico mentioned NPN, National Preventionist Network. That's another on-the-ground structure that's in place. Yeah, I think you also mentioned National Prevention Science Coalition, or maybe Margaret, you did. The CDCs have prevention research centers. So those are just a few, but I think we are in a good place to build on what we have and advocate for ongoing support for those structures that really do promote workforce development. All right, my last 2 points. This one I think is not necessarily aligned with the report, maybe possibly is more controversial. I don't know, I'll have to hear what the report writers say. But the report really emphasizes the value of that workforce development should encourage, appropriately compensated folks in the profession, which I strongly agree with. And I would this recommendation I add to that to say, I think particularly at this time of constrained resources, looking for ways to not only expand the paid workforce, but to think about our volunteer capacity. And speaking as a developmental psychologist, I'm going to now put on my developmental psychology hat and say I think we have two really neat opportunities. One is adolescence, and the other is adulthood, kind of the retirement age community, because in both of those, for different reasons, you have people at a life stage in development where they're really get a lot of meaning and purpose and identity out of volunteering. A lot of high schools do promote volunteer activities, so I think we could have a win-win. These are not necessarily paid opportunities, but we know that both in adolescence and in older adulthood, that those opportunities to volunteer in meaningful ways where you're helping people and then infusing that with a prevention science background, we may be able to grow the workforce in a unique way while also promoting the wellness of adolescents and older adults. The last point I want to make is just one around a kind of a primary prevention approach. So just thinking outside of using our framework of primary prevention and just thinking about, there's a lot of people don't really know what prevention science is in the general public. So how can we in our fields be connecting more with the K-12 systems, both directly in terms of, having resources or structures for us to be able to be informing the K-12 teacher educational system students so that we're both implementing prevention practices in those systems, but also informing young people of what prevention science is and the value of it so that we have this long-term primary prevention benefit of potentially increasing the workforce 10 to 20 years from now. So that's more of a longer view, but that was the last point I wanted to make. Thank you.
Thanks, Leslie. Any of the other panelists have thoughts on workforce that you want to share, or questions, comments? We have time. Yeah.
So
Go ahead.
and this is a question to Leslie. There are several credentialing prevention-related organizations that do exist, and so maybe this is a question for Margaret as well. How did you incorporate what they're doing or not? And so, because I want to be clear, there are credentialing organizations with Zilly started one, so which have a prevention focus, and so I don't know if it's at ground zero, and I don't know if the report's saying that, but I am curious about how we incorporated what's existing in terms of building a workforce and how that was incorporated into the report.
That might be a question for you, Margaret. Yeah.
Yeah, I think so. All right, this is still on. Excuse me, the chapter is very rich and long, and you will see reference to some of those structures that have to do with competencies, like SAMHSA's competencies in the report. So I'd agree with you that we're not starting at ground zero. Did that answer your question?
Partly.
I think it is. Yeah.
I guess the other part is making sure that those other existing systems are a part of the conversation and that we're building them. So SAMHSA is one, but again, there are several credentialing organizations and systems that currently exist, and how we leverage those partly, and I will talk about this issue of awareness in a minute, making sure folks even know they exist, right? And then how do you build upon them? And then the second part, Leslie, to you is that, and how we attach those to the academy, right? And so some of those got developed in isolation, not necessarily being integrated into the curriculum now, and so just kind of understanding how we integrate and leverage what is already existing.
So I think the soon-to-be-developed task force on implementing the report's recommendations, I'm saying that kiddingly, I think it would be important in conversations like this with the community to identify those organizations that already exist, at least to some degree, that can help put those recommendations into place, including developing these competencies further and workforce qualifications.
I agree.
I'll share too, kind of related, is if I'll put a plug in too for Friday morning, bright and early, first session. We're providing an update on the standards of knowledge in prevention science, which also has to do with this conversation. And we've had conversations too, Phillip, about kind of the crosswalk between prevention practice competencies and how those align or don't with kind of our prevention research competencies, or how they can work together and complement one another. So there's some of those conversations happening, at least through that task force as well. And we're excited to share a close to final version of our new standards of knowledge in prevention science, updated version on Friday.
2 comments?
Yeah.
So Leslie, I just wanted to pick up on a couple of your comments. One around the SIP classification. This issue of having categories for prevention workers in the standard employment occupation classification system is a really important one. It can sound so sort of technical, but having those classifications does help with what you're talking about. It also, from what I understand, can help with wages and create wage stability, maybe employment ladders, and things like that are really important for turnover in the prevention workforce. So I think these workforce issues really deserve a lot of attention. And then you made another point on workforce that you said was controversial. I'm forgetting the specifics.
Volunteers.
Using volunteers. I think, you know, there is tension between paying people for volunteering, et cetera, but I think it's that kind of creative thinking that we need right now about thinking about how adolescents can gain a lot and feel a lot of personal benefit from that volunteering, and older Americans too. So I think that's, I'm not speaking for the committee, I'm speaking as me. I think that's a great point.
It's a great twofer because it's a great twofer because you may have an intervention-like effect on the adolescents, and the older adults will feel more connected, involved, and participatory, so there might be some prevention effect.
Thank you. So I'm going to go ahead and move us forward to our final prepared question that I have for Phillip. So this is kind of bringing us home back to what SPR can do, what role that our organization can play. So if you could share a little bit about your vision at this point, Phil, of the vision for SPR's role in supporting the national prevention infrastructure. For example, the report calls out the importance of closing research gaps in the evidence base of preventive interventions for adults. It also calls out the importance of adequate data infrastructure for community prevention planning and monitoring. How do you think SPR can or should contribute to these or any of the other recommendations from the report?
I got the easy one,
Save
right?
the easy one for you, yeah.
You know, the pro and con about going last, often you get to hear what's said and piggyback off of it, but often what you want to say has already been said. So just a combination. I have a bad habit of asking questions, which drive my wife crazy, but this is the way I was trained. And so I will start with a question. You heard Rico and you heard Leslie talk about NPN, National Prevention Network Directors. By a show of hands, who knows what NPN is and does? Okay. How many of you know your state's NPN? Okay. Your raising of hands or lack thereof is a part of my vision. And so I'll start by saying my vision has changed since I wrote it up when you voted for me, and it's not my fault that it's changed. But I first want to start with, we have to tell a better story, or we have to tell our story differently. And what I mean by that is that many of you will go forth and create incredible interventions, and some of you will only care about how many journal articles are written based on that RCT and tested intervention that you develop. Part of my vision is to challenge you about the why, and to say at any time, but absolutely at this time, it is critically important that we make sure that what we develop ends up in communities, being used by communities to change the human condition. If we're not doing that, I ask the question about why are you doing it? So I will be provocative in this role because I want this incredible organization to move forward in doing our work better. And so I will use words such as co-design, citizen scientists, and community engaged research as a way of doing what we do. You all have been trained to do this work well, but have you been trained to how to do this work? And so for me, in terms of closing the gaps, is understanding the value of those who we work with, understanding the value of lived experiences, and learning the value of thinking about how community helps us do what we do. As SPS researchers, we'll need to spend time understanding the current or future infrastructure and figure out how to better engage it. And so as I started by asking the question, most of the prevention funding that comes to communities currently comes from SAMHSA as a part of a block grant. It's 80% for treatment and 20% for prevention. And until the opioid epidemic, that was the primary funding source for every state and jurisdiction in this country. If you don't know where the funds are coming from to fund the work and the strategy that you're developing, you miss a critical opportunity to inform the decision making. It is also clear that communities are tired of evidence-based strategies that seem to be too complicated, too long, and too difficult to implement. Yeah. And so folks are asking if Dennis Embry was here about kernels. I just need to know, of those 25 sessions, tell me 5 that I can use to change the world. We have to begin to think of, in the same way that communities do, about solving problems. And so to close that gap, we have to ask the questions of those we're working with. We know a small amount of the variances explained on any intervention if it works. I contend that that unexplained variance lives in community. And so as a part of my vision and a part of our vision is to begin to recognize that, the value and beauty of what would happen if you developed interventions with communities at T0. Not the adaptation, but the initial design. And that's about understanding theory from a community perspective. And so I believe in doing that, that's how we close gaps. I also have a big concern about data and the current assault on data collection and data access. Databases have disappeared. The ability to find and retrieve data for community planning becomes non-existent. And so I think this year's conference is an example of really thinking about how vitally important it is to look at other tools to help us do that better. And I'm not saying AI is going to replace our data collection and machine learning, but I'm saying in partnership with those who use those tools, how do we begin to fill that gap? Data doesn't exist at community level in which we already need it, and so much work needs to be done there. And so I am going to encourage us to figure out innovative ways to think about how you collect better local data, still in a very scientific and rigorous way. Because despite what all has been said in vision changing, what we aren't changing is that science is first. And we'll continue to do that until someone says we can't. The other piece is thinking about translation and dissemination. For all of those of you who develop interventions, what NIDA and what other funders don't do is help you with translation and dissemination. So again, nothing gets manualized and nothing gets shared with communities. And so we have to do a better job of understanding the importance of translation and dissemination in the work and how we do it. And then the last thing I'll say is that we are just getting started. I do feel that in this time of uncertainty, in this time of assault on science, I think we rally to the cause. And so how do we leverage the best of our experiences, the best of our knowledge, to figure out how to do this work in spite of it? A lot of it will be done at the state level. It is at least my hope that what doesn't get touched is block grants to states. And so again, understanding state and local funding is going to be key and critical to moving forward. And so I encourage you each to better understand that state and local infrastructure in general, and then more specifically as it relates to the funding of prevention and figuring out how we do a better job of both disseminating what we're doing, increasing the awareness, and increasing the uptake and adoption of evidence-based strategies and interventions. But that must be done in partnership with community, not as an afterthought, not in a state where you do the work and they come along and we say thank you. And so those are some of the things I'm beginning to think about. As I said, my vision is it's being tweaked in real time in response to real-time circumstances, but I'm trying to move from being discouraged to encourage that I believe this organization should be at the forefront of promoting what is going to be needed to improve the condition of our communities. So thank you.
Thank you. We have a couple of minutes remaining. If any of the other panelists want to react to, ask questions of Phil, since he asked you questions, feel free. I also want to remind folks that there's an opportunity after the end of the session, after the break, to come back and ask your own questions of the panelists and share your viewpoints and have some discussion. I was fortunate enough to invite my state NPN, who is sitting in the front here, Sarah Mariani, who's going to join us for that discussion as well, to bring some of that state perspective and some of the more from the local community and that infrastructure. So I'm excited for that. Any other final thoughts, comments, words of wisdom as we depart?
I will ask, in terms of sharing this report more broadly, what are the thoughts about reaching out to philanthropic organizations in a very proactive way? Now, I know one of our new challenges is that philanthropic organizations have been overrun. Everyone's turning to them. However, I wonder if that's part of the thinking around just sharing that broadly for additional support and funding.
I think that things like that are really important. We are having a dissemination workshop in Washington in late June. I know that some NIDA folks will be at that workshop. I don't know who else will be at that, but I imagine some philanthropic organizations will be. I think the more we can do to share the report with those who are in a position to influence or enact the recommendations, the better.
Any other comments? Okay. Are you sure? Okay. Yes, Bethany.
Could you put the QR code back?
Oh, sure. I can do that. Let me, if I can scroll. Yes. Oh, there it is. Thank you for the reminder. Well, thank you. Will you all join me in a round of applause? I really appreciate these wonderful minds coming together to share their thoughts with us. Thank you again.